Early on in the pandemic, we started the COVID-19 Echo, and it wasn't long before we realized that before the pandemic, most healthcare providers did not utilize telemedicine or telehealth. During and since the pandemic, most healthcare providers have used telehealth. And so we had a very acute and rapid need to transmit information to healthcare providers about the use of telehealth. The Echo session starts with just a short lecture or didactic, just a very short lecture. And we try to make that less than 25% of the entire Echo session because we know, based on the principles of adult learning, that the real value in an educational program for healthcare providers is in the case-based discussions. And so we do a short lecture, but we spend most of the time talking about the art and science of managing patient cases that participants have sent in ahead of time. When I started doing telemedicine in the mid 1990s, I was taking care of one patient at a time. I did that for 26 years. I did teledermatology all over Missouri, from the Iowa to the Arkansas border. But every time I did that, I took care of one patient at a time. Now, when we do echo sessions, in dermatology, we can teach, 20 healthcare providers to take care of patients just like that. So it really is a force multiplier. It really is demonopolizing our expert knowledge. And that's what we need to do. And we can use technology to do this, to get our expertise into the hands of the providers in the communities where the patients are. Because healthcare is best if it's regional, if not local. Because local healthcare providers know about the culture surrounding the patient, the healthcare resources, the healthcare infrastructure. They know how to get the patient the health resources and information that they need. And so really, if we can support those local healthcare providers and mentor them and keep them from feeling isolated and keep them in those communities, that's going to be the best thing for Missourians in the long run.
This video was made possible by the Heartland Telehealth Resource Center through grant CTRC-GA5RH37462 from the Office for the Advancement of Telehealth, Federal Office of Rural Health Policy, Health Resources and Services Administration, and Department of Health and Human Services.